members in the press and media for this, on the occasion of this orthopedic CME, Apollo Cosmos 2018, to discuss the latest on the ortho care, especially with reference to the knee joint and shoulder joint. On all our behalf, I have great pleasure in welcoming Dr. Jonathan Herald, who's come from Australia. He's no stranger to Apollo or Chennai or to India. He keeps coming very frequently to Chennai. He's a renowned shoulder specialist. He'll be talking to you about that. Apollo Hospital, orthopedics is one of the very prestigious departments. It's one of the centers of excellence, along with cardiology, neurology, emergency, oncology, and transplant medicine. We do have many orthopedic surgeons who have been trained abroad. After they finished their graduation in India, they've gone abroad, they've advanced their skills and they come back and they serve our patients here. In this conference, they will be talking about, medicine is one science which is almost everyday. For that purpose, this CME will be of a great help in that we have experts, international experts from, apart from Australia, we have from UK, USA, Dubai and Netherlands. Doctors have come. They'll be sharing with ortho doctors from all across India, the senior specialists, and then they have an interaction, discussion, and then they have sharing of knowledge, the skills, so that the ultimate benefit will be the patients. Because we have newer methods of doing surgery using a robot, or using a very small incision or no incision through the endoscopic surgeries. And we have got newer methods of pain management, and we have non-surgical management for trauma and sports injury. There are lots of things happening. So this will be a forum and all of them will be discussing. We have over 500 registrations from all across. Apart from the ortho surgeons, we also have physiotherapists, and other support group also will be a part of this conference. So I think all in all, it will be a really knowledge gain for everybody. And I extend a warm invitation to all of you to come to the evening function, where Dr. Radhakrishnan, the Principal Secretary, Health and Family Welfare, will be a chief guest also. Thank you once again. Now I request Dr. Madan to take us through the highlights of this conference. Thank you.
Good morning, everyone. It is a great pleasure to invite all of you for this Apollo Cosmic 2018. This year, it is a two-day meeting. First day, we are going to focus on the knee replacement latest developments. So it is called unicondylar knee replacement, revision knee replacement, and pain management. These are the three highlights. And basically, what patient is looking for nowadays is the faster recovery. They don't want any pain. They want to get back to their normal social and recreational activities as soon as possible. That's what patient is looking for. The other most important thing, what patient is looking for is, once we do surgery, previously we used to promise this is going to last 10 to 15 years. But they want this particular surgery to be as a lifetime surgery, which means these implants should last long. So these are the developments happened in the field of orthopedics. And previously we used to do the knee replacement means we used to change the whole joint. But nowadays we have a special technique called unicondylar knee replacement, which means whichever part of the knee is worn out, we change that part and we can send these patients. So most of the times what happens is, we do the surgery in the morning, but evening these patients are standing, next day they are walking. Most of the times, the day after tomorrow, they are going home. They come as an outpatient for suture removal and rehabilitation. So the other important thing people used to fear about these surgeries before is pain. The pain management after this surgery is a big game changer. Both immediate operation and also post long term. So immediate post-op, we have special blocks we give. So the patient will have less pain, but at the same time, they have the mobility. That's the biggest game changer for this knee replacement surgery. On the second day, that is tomorrow, we are going to focus on the knee and shoulder arthroscopic surgeries. See, nowadays what's happening is, instead of replacement, we are focusing more on the joint preservation techniques. So we have a lot of treatments like PRP, stem cells. So by doing this kind of small non-invasive procedures, we can repair or restore the cartilage which is damaged. So which means there is no replacement, we are repairing the damaged cartilage. So which means the patient will have normal movement and the recovery is much faster, it is cheaper, and there is no hospitalization involved in this particular techniques. So I will invite the Kunal. He will take you through latest techniques what we use for the knee replacement surgeries like navigation and robotic techniques. Kunal.
I would once again like to thank all of you for being here from the press and covering our conference. So some of the few things that we are trying to highlight in this conference is robotic knee surgeries. Now, robotic knee surgeries are very new in India. As you know, as always, Apollo has been the first to do everything in India. It's been the first corporate hospital and so on. And so we believe in doing something for the first time. And this time, we are trying to introduce, we've been the first to have navigation for knee replacement. So navigation basically helps in accuracy of the knee replacement. This was done about 14 years ago. Apollo had got navigation for knee replacement, and this had helped improving the accuracy and improving the outcomes for knee replacement. And now we are in the process of also getting robotics for knee replacement. Robotic knee replacement is the next step forward in knee replacement surgeries. Robotic knee is for both for unicondylar knees as well as for bicondylar knees for doing total knee replacement. So it's going to be a very helpful tool, and Apollo is in the process of getting that. And so these are the main things that we are demonstrating here in the conference, as well as live surgeries that we were trying to demonstrate on unicondylar knees. The advantages of doing these robotic knee surgeries, what we will see in the future would be that you will see that the patients are able to walk much better, they have much higher comfort levels after surgery and lesser pain after surgery. So these are the few facts that you will see once this robotics comes into play, and we will be one of the first few people in the country again to have it and have the robotic system. Thank you. I would like to invite Dr. Jonathan Herald,
Apollo Main Hospitals. So tomorrow we are looking. So we have an association with Dr. Jonathan Herald, who is from Sydney. Right from the way back, I think 4 years we've been in contact with him, and all our very high-end shoulder surgeons has been there always with us. You know, whenever we have any complex shoulder surgeries, we discuss with them and we do the best. So tomorrow we have a knee arthroscopy and shoulder arthroscopy. We are doing some very high-end complex knee and shoulder arthroscopies, including bank cords and shoulder cuff repairs. So there are going to be 3 live. Jonathan, can please come here, sir.
Well, thank you, Vijay. Thank you, Marvin, and thank you everyone for inviting me today. I'm an orthopaedic surgeon from Sydney, Australia. I do mostly sports injuries. I treat a lot of elite athletes. There are a couple of football teams that I look after, and some cricketing bodies. But a lot of the injuries that I treat require a lot of arthroscopic equipment, high-level equipment, and all of that is here in Apollo Hospital, which I'm quite impressed about. The equipment that I'm using tomorrow for the surgical demonstrations is the same equipment that I use in Australia in my hospital. And I'm very pleased with the updates that we've had here and the discussions and the conferencing that we've had in the education, as it's all on an international level and on par with standards in Australia as well. I've had the pleasure of having people like Vijay come and work with me, and Dinesh Chowdhury, another distinguished orthopaedic surgeon from Apollo Hospital, who's come to Australia and worked in my unit for additional training and have come back and been leaders in the field here, like Vijay organising this conference today. You know, a leader in the field in India in shoulder arthroscopy and knee arthroscopic surgery, as well as joint replacement surgery. Today we had an excellent discussion about unicompartmental knee replacements. We were talking about the smaller incisions, the quicker returns to work, and the fact that we were using continuous blocks. We had a demonstration of how the block was done, which allows people to almost have their surgical procedure as a day surgery procedure. So someone who's having a half knee replacement may be able to go home the same day. So I'm quite impressed at the level of...
It's a pleasure to be here again. I've been coming to India now for nearly 20 years in various places around India, but Chennai was the first place I ever came to. I've been back frequently to see the guys at the Apollo. I'm a knee replacement surgeon. It's what I do. I've been doing it for 38 years now. And I've seen a huge change in what we're able to do for patients over that time. The implants we now have are far better than we ever had when we first started doing this surgery. Our knowledge of how to put them in has really changed over the last 30 years. And those skills are present in all of the arthroplasty surgeons here in Chennai. We've been doing some unicondylar knees today, the concept being that if only part of your knee is damaged, why not just replace that one part? And it is a very good operation. I've always thought it was a great operation for the Indian market because of the sort of bad knees that you get. The big problem in India is that most of your patients come up very late. So by the time they do come up, the arthritis is affecting the whole joint and not just part of the joint. And I think that's going to change. It seems to me it has changed over the last 20 years. We are seeing patients now who are coming forward earlier, and they'll become good candidates for modern unicondylar replacements. They give you better function, you recover quicker, and it's an excellent prosthesis. Total knee is still a very excellent prosthesis as well for those patients that require it. And I think the other thing that's changed in India is that patients are more accepting of joint replacements now, which they weren't 20 years ago, which is the same experience we had in Western Europe. In the 70s and 80s, people didn't want joint replacements because they thought they didn't last very long. But now we know they do. It's an excellent operation, and it gives patients independence back again. So it's certainly not an operation to be frightened of. You've heard something about navigation and robotics. These are new ways of putting these implants in. I'm a little sceptical. It remains to be seen how well they're going to do, because it's new technology. But there's a lot of promise there in improving the way we can manage these operations in patients. So I think, all in all, India's in a good place when it comes to joint replacement surgery, particularly in hospitals like the Apollo, where there's a high level of skill and equipment. And I've enjoyed operating here many times over the last few years. Are there any questions?
We all will sit together and then...
Whoops.
Or you can talk about new technology, what we have, how it is going to help for the outcomes of the patient.
If you would tell us about the new technology, that would be great, sir.
We have navigation system. So as I told you, the patients are expecting, see now more and more young arthritic patients we are seeing. So they need the knee replacement. When we consider